Today we are going to talk about muscles of the trunk. In the muscles of the trunk, the first question is naming and identification of abdominal muscles. Okay? So there are 4 abdominal muscles. Naming 4 abdominal muscles. There is rectus abdominis. Okay? Rectus abdominis.
Yes.
External oblique. Okay? The fibers are coming down. External oblique.
Yes.
Here it is, external oblique.
Yes.
Internal oblique going here like this.
From where?
This can you see the fibers? These are internal obliques. This is external oblique. This is rectus abdominis. And inside, the deeper inside, can you see the transverse? This is the transverse abdominis. Okay? So these are the 4 abdominal muscles. So naming and identification means abdominal muscles. You have to name these 4 muscles and you have to identify them. Okay?
Okay.
Now, going to each muscle, origin, insertion, action. Origin, first muscle, rectus abdominis. Rectus abdominis, can you give me the skeleton? We'll start from here. Can you see the pubic red line? Can you see this red line? This is the origin of rectus abdominis.
What?
Pubic symphysis.
Pubic.
Okay?
This is muscle.
Pubic symphysis. That is the
Bone.
That is the bone.
Yeah.
Where this muscle start. This muscle,
Yes. Rectus.
rectus abdominis, starts from here. Okay?
Yes.
Starts on pubic symphysis. Starts here. Ends in the xiphoid. Can you see the red line here?
Exoid.
Okay? Xiphoid process. Okay, of sternum. And lower ribs. Can you see here lines 1, 2? Okay? It is this one and this one. These are the insertions of rectus abdominis. So, when muscle is going from here, pelvis, to the sternum. So, what it can do? It can bend. So, it can do flexion. Okay? It cannot do extension. It can do only flexion. And it can do, for example, this pelvis. This is posterior tilt, this is anterior tilt. So when muscle pulls, it will do posterior tilt. Okay? So the second action is posterior tilt.
Rotation or not?
No rotation. Posterior tilt, moving the pelvis backwards. And when it goes inside, like everybody, pull your stomach inside. What happens to the pressure inside the abdomen? Increases. Pressure increases. Space decreases. Okay? Now everybody keep hand on the stomach. Cuff.
Tension.
There is increase in tension.
Yes. The Neuro.
Contract. It is must. When you want to cuff, the pressure inside the abdomen has to increase. So which muscle will increase? Rectus abdominis is one of the muscle which increases pressure inside the abdomen. Even when you want to defecate, for example, when you want to pass the feces outside. So that is the time also when you want to increase the pressure inside the abdomen, it is going to increase.
All of this muscle.
All of it are called as abdominals. 4 muscles are abdominals. So now we started with 1. We finished 1. The second one, external oblique muscle. The external oblique muscle, you see here, this is the external oblique muscle. You see here. This is the external oblique muscle. All this, full muscle.
External.
Oblique. Oblique means something, okay? So like line, oblique. This is oblique. So this is external because it is outside muscle. Internal means it is inside muscle. So the first layer of abdominals are rectus, second layer of abdominals are external oblique, third layer of abdominals are internal oblique, fourth layer of abdominals are transverse abdominals, deeper most muscle. So this external oblique starts from, can you see this muscle?
Yes.
Anterior-lateral borders of the lower 8 ribs. Okay? Lower 8 ribs. All these ribs. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8. Can you see the red marks?
2, 8.
Lower 8 ribs. This is the origin of external oblique. Okay? It's the origin of external oblique. Insertion. It inserts into the abdominal sheath, anterior rectus sheath. It is inserts into the anterior rectus sheath or linea alba. What is sheath? If you see this clearly, can you see this is little white? Can you see this is white and this is red? Yes?
Yes.
Because there is a covering on the rectus muscle.
This covering.
Yeah, this is the covering.
Yeah.
So this external oblique comes and inserts into the covering. Okay? It inserts into the covering of the abdominal muscle. Rectus sheath it is called as. And some of the muscles have insertion to iliac crest. Okay? Can you see this blue line? External oblique. Yes. So it starts here and it ends in iliac crest. Okay? And it ends in the rectus sheath of the abdominal muscles. So two insertions.
Origin and the insertion.
Origin and insertion of the external oblique. If you see red mark, that is usually origin. Blue mark, that is usually insertion. Okay, in the skeleton. So if you see this blue line, this is the insertion of external oblique. Oblique, external oblique. Red line, this is the origin of external oblique. Okay, then what is the action of external oblique?
This external
Oblique.
oblique. With this internal.
Internal oblique. I will tell internal oblique later.
Yeah.
First you learn about external oblique. Rectus is this one. Okay? External oblique actions, it is like same as rectus abdominis. When it is acting together, both side muscles are action together, then it will do flexion, it will do posterior pelvic tilt, it will do increase in abdominal pressure. But when it acts alone, one side, for example this side, if it pulls, so it will cause rotation to opposite side.
Like a sternocleidomastoid muscle.
Yes. Okay. So when it pulls, it causes rotation to opposite
Outside.
side. So external oblique, one of the important action is rotation to the opposite side. That means if I say left rotation, which external oblique is working? Left rotation.
The right.
The right.
Right external oblique will be working. Okay?
Yes.
So that is the action of external oblique. Now comes to internal oblique. Internal oblique is, can you see this one? This is all internal oblique. This is pelvic crust or pelvic rib. This one. This is the pelvic crust. So internal oblique starts here. Can you see the red line?
Yeah.
So this is the starting mark for internal oblique. So starting mark for internal oblique. It is going to insert or it is going to end into the costal cartilages of 8th to 12th ribs. Okay, can you see here the blue lines? So it's going to end in these costal cartilages. Not inside, it will end in the here. Sorry, not here. It will end in the here. These are the costal cartilages. So internal oblique is going to end like this. Okay, to the costal cartilages and to the rectus sheath. Okay, two insertions. So this is about internal oblique. So what is the action of internal oblique? Internal oblique causes increase in tension, or same like all other abdominals do. But another important action is rotation to the same side. When you want to rotate the trunk, it will do the rotation to same side because it is like this. When you want to rotate, can you see? Right rotation will be done by internal oblique of the same muscle.
This external.
So during a rotation, external oblique of one side, internal oblique of opposite side, they work together. Then do rotation. Okay? So that means if I am doing a left rotation, right side external oblique, left side internal oblique will act together.
Yes.
تتصل مع بعض.
Yeah.
Okay?
عملها.
So they are together.
Yes, yes.
This side external oblique, this side internal oblique, they do the rotation to one side. Now tell me example, if the patient is doing right side rotation, which side external oblique, which side internal oblique are working?
The left it's external.
Left external oblique,
And the right is internal.
right internal oblique. Okay? So that is the action of internal oblique and external oblique if they are acting alone, one side. If they are acting together, then they increase the abdominal pressure.
Increase what?
Abdominal pressure.
Pressure.
Increase the abdominal pressure. You see transverse abdominis. This is all transverse abdominis. Okay? The transverse abdominis, can you see the line transverse?
Yes.
The transverse abdominis is the deepest abdominal muscle, deepermost
This?
abdominal muscle.
This?
Yes.
Transverse.
Transverse abdominis is the transverse abdominal muscle, deepermost muscle. The main action is increase the abdominal pressure, maintain the posture. For example, after some days, you become like this, because lack of good power in the abdomen. Okay? So this is about abdominals. Any doubts? Origin and insertion of transverse abdominis. Transverse abdominis, origin is from iliac crest, okay, and thoracolumbar fascia, costal margins of the ribs, insertion into anterior rectus sheath, pubic crust, and aponeurosis of the posterior muscles. Okay, so that is about action, origin, insertion of abdominal muscles. Next one, serratus anterior. The next muscle is serratus anterior.
Can you repeat?
Serratus.
Serratus
Serratus.
anterior. Okay, this is the serratus anterior muscle. The serratus anterior muscle starts from scapula. You see the scapula? If you see this red line,
Yeah.
the whole red, that is the origin of serratus anterior. Okay, the whole red portion, origin of serratus anterior, and it comes and inserts into the ribs. 1, 2, 3, 4, 5. First 5 ribs. Okay, it starts in the scapula and it ends in the first 5 ribs. So what is the action? Action of serratus anterior is boxing. Okay, it's a muscle of boxing, and to push anything, it is useful, and it is useful to keep the scapula attached to the thorax. If this muscle is not there, there will be winging of the scapula. That means scapula go away from the thorax. Okay? If you don't, this muscle don't act, then it will go away from the thorax. That is the action of serratus anterior. And any movements of upper extremity, overhead abduction, another action, serratus anterior.
Yes.
Overhead abduction, overhead flexion, that is also done by the serratus anterior. Inspiration, muscles of expiration. What are the muscles which causes inspiration? What are the muscles which cause expiration? The muscles of inspiration, the major muscles are diaphragm. The major muscle is diaphragm.
Yes.
Yes. You see this one?
Yes.
Okay. This is the diaphragm muscle. Diaphragm.
Yeah.
No G. G is silent. G is silent. This muscle. Okay. This is the diaphragm. It's like a dome-shaped muscle. It's like a dome here, like this. Okay. So, how it will do inspiration?
Contract.
When it contracts, okay, it increases pressure. So it decreases pressure. When the pressure decreases,
Sizing.
the air goes inside. Okay? The diaphragm is like this muscle. When it contracts, it decreases pressure. When it decreases pressure here, it creates like vacuum. When the vacuum is created, the air will go inside the lungs. Okay? So that is the diaphragm. One important muscle for inspiration. Second muscle of inspiration is external intercostals. External intercostals for inspiration is external intercostals. External intercostals. Inter means between. Costal means ribs. External means outside. Like how you have external oblique, internal oblique. Like that you have in the ribs. External intercostals, internal intercostals. External intercostals are like this. They elevate the rib. Elevate the rib. So, when you external intercostal acts, the anterior posterior diameter of the chest wall is going to increase. When anterior posterior diameter increases, you breathe in. Okay? The opposite muscle I will tell you. So this is for external intercostals, diaphragm, other muscles like sternocleidomastoid, scalenii. Okay, sternocleidomastoid, scalenii. Here it is clear. See. These are scalenii. 1, 2, 3. Okay? This one. Not clear. Okay, here it is not clear, but here it is clear. Sternocleidomastoid, scalenii. They also will do inspiration. So 4 muscles will do inspiration. Diaphragm, external intercostals, sternocleidomastoid, scalenii. Okay? Which muscles will force the air outside? One, internal intercostals. See here. These are the external intercostals. These are the internal intercostals. Okay? These are the external intercostals. These are the external intercostals outside. These are the internal intercostals inside. So internal intercostals will decrease the ribs, so the air will come outside. And abdominals, all the 4 abdominals. Rectus abdominis, external oblique, internal oblique, transverse abdominis, all these 4 are muscles of expiration. Okay? So these are the muscles of inspiration and muscles of expiration. The next muscle is iliopsoas. The next muscle is iliopsoas. So iliopsoas is a two muscles actually, but it is together. If you see in the picture, it is like this. Okay? If you see the origin, like lumbar spine, 1, 2, 3, 4, 5. Okay? This is all origin of psoas major. Okay, it's all origin of psoas major. And this is the origin. The iliac bone is the origin for iliacus. So iliopsoas. Together, these two muscles go cross the pelvis and insert into the lesser trochanter of the femur. Okay? So the muscle is like this. The muscle is like this. So when this contracts, it will do hip flexion. Okay? When this muscle contracts, it will do hip flexion. This is the major action of iliopsoas. Huh? Iliopsoas together, it is flexion. Muscles of flexion for hip, and at the same time, it will do external rotation. It will do external rotation and flexion. So that is about iliopsoas muscle. The next one is Quadratus Lumborum. Quadratus Lumborum. The muscle starts from again iliac crest. It starts from the iliac crest and it attaches to the thoracic, the lumbar vertebrae, transverse process and lower ribs. Attached to the transverse process of lumbar spine and lower ribs. It attaches to the lower ribs, and what it does lateral flexion. Quadratus lumborum does lateral flexion, one side flexion. You see, there are two V-shaped muscles in the back. The first V-shape is by the trapezius. So this is one side, opposite side also it is there, but it is shown here one side. The lower fibers, middle fibers, upper fibers. Lower fibers, middle fibers, upper fibers.
It's only one muscle.
Trapezius. Okay. The origin is from vertebra of T6 to T12, fascio-thoracolumbar fascia, pelvic bone or iliac crest. Starts from here, iliac crest. It starts from occipital groove, occipital protuberance, nuchal lines, and it is there from cervical and thoracic vertebrae. Origin, insertion into the spine of the scapula. You see the spine of the scapula? Spine of the scapula. This is the insertion for trapezius. Upper trapezius will do elevation of the scapula. Middle trapezius will do adduction of the scapula, adduction of the scapula. Lower trapezius will do depression of the scapula.
كذا.
Yes. Depression of scapula. This is elevation. Elevation,
حركات السكابولا.
adduction, depression.
How many?
3.
3 movements.
Depression.
Now, next muscle is latissimus dorsi. Latissimus dorsi. Latissimus dorsi, you see here, this is latissimus dorsi. Going inside. Okay, these are latissimus dorsi. This latissimus dorsi will go and insert into the humerus. It inserts here, the bicipital groove. Okay, so it starts in the pelvis. It will go like this, inserts into the one part into the inferior angle of the scapula, another part into the bicipital groove. Okay, so what is the action? It will do extension, adduction, extension, adduction, and internal rotation of shoulder. Extension,
Again, doctor.
adduction, internal rotation of shoulder. That is the action of latissimus dorsi. Similar, my hand position. This is the action of latissimus dorsi.
This
Yeah, this muscle.
dorsal.
Latissimus erector spinae. It is better in the picture. Erector spinae has 3 divisions. It has iliocostalis, longissimus, spinalis. Each one again further divided into 3. If you see the PowerPoint, you will understand this. Erector spinae is the major muscle which is there, the half of the back. The muscle action is extension of the
Not
spine.
this. Not this.
These are parts of the muscle,
Yes.
but the major muscle is deeper.
Deep.
Okay?
Yeah.
It has more than 9 muscles together, called as erector spinae.
Broad muscle.
Group of muscles. Like hamstrings, calf, like that erector spinae. They do extension of the back.
Yes. Other than that.
Now, the movements of trunk, Shabab, movements of the trunk, the movements of the trunk are flexion, okay, extension, lateral flexion to left, lateral flexion to right, rotation to left, rotation to right. Now, muscles which produce this movement, flexion, which muscles? Abdominals, 4 abdominals. Okay? Flexion, 4 abdominals. Rectus abdominis, external oblique, internal oblique, transverse abdominis. Extension, erector spinae. Okay? Extension is done by erector spinae. Lateral flexion, external oblique, Quadratus Lumborum, erector spinae of one side. So one abdominal, one back, one side muscles will produce lateral flexion. Okay? Rotation. External oblique of one side, internal oblique of opposite side will produce rotation. Whichever side you rotate, that side back extensors, that is erector spinae muscle also works. So 3 muscle will do rotation. If I am turning towards left, erector spinae of left side, internal oblique of left side, external oblique of right side. This is for left rotation. If I am doing right rotation, tell.
Left back.
Left external
Left external
oblique,
oblique.
Right,
right erector spinae,
right,
internal
Iliac.
oblique. Okay, so that is about spine movements and the muscles which do the movements.
Victor, oblique or oblique?
Oblique,
Oblique.
oblique, oblique. Now, the movements of pelvis, the pelvis movements anterior tilt, this is anterior tilt, posterior tilt. Okay, moving the pelvis is posterior tilt, moving the pelvis is anterior tilt. The muscles which do posterior tilt. Okay, if you go for here, rectus abdominis, external oblique, internal oblique, gluteus maximus, hamstrings. Where is gluteus maximus? See, this is gluteus maximus. Okay, and these are the hamstrings. These are the hamstrings. So, hamstrings. So, gluteus maximus, hamstrings, external oblique, internal oblique, rectus abdominis. These all together will do posterior pelvic tilt. Okay? Anterior pelvic tilt. The muscles of anterior pelvic tilt. Erector spinae, erector spinae, iliopsoas, inside deep muscle, iliopsoas, and rectus femoris. This muscle. The rectus femoris, erector spinae, and iliopsoas will do anterior pelvic.